If you've got back pain, you're in the right place. In this video, we're going to talk about fundamental principles and show you some key strategies to help you fix back pain yourself. And at the end of this video, we're going to talk about some simple strategies you can implement in daily life to help you improve your back pain, get stronger and more resilient over time, and be pain-free. I'm Matt Hsu from Upright Health, where we help you think right, move right, and feel right. In this video, I'm going to share what I've learned over the years, both personally and professionally, with back pain. I had tons of back pain problems starting in high school, and my team and I work with people on a really regular basis who have back pain. So what you're going to learn in this video is based on everything I've learned, our clients have learned, and all of the trainers at Upright Health have learned. If you have back pain, there's one key idea you've got to keep in mind if you want to avoid wasting time, money, and your health on ineffective, expensive, and sometimes really bad for you treatments. That idea is ATM. Always think muscles. When you look at x-rays and MRIs, what you see is not what you get. You'll actually discover, if you dig into the research, what you find in an x-ray and what you find in an MRI, no matter how bad it is, often has almost no correlation, if any, to having pain. The problem is doctors and surgeons are always looking at these images to try to find a cause when those images don't actually show you anything that's relevant. Unless you have something really bad like cancer in your spine or something, but that's a super, super rare instance. Over the course of medical history, the diagnoses made from x-rays and MRIs for structural problems have turned out very consistently to have nothing to do with people's pain. So if that's the case, we need to look at what you can control and what you can work on for yourself at home, and that is your muscles. This idea, ATM, works for your back, it works for your hips, it works for your knees, it works for your shoulders. It's what works, and it's the least invasive, most cost-effective way to help you with your back pain. Now that we have that fundamental idea covered, let's talk about how you fix your back pain. The thing you need to do is look for imbalances. Look for places where your body is not equally strong or not symmetrical. Now, if you need some help with that, we've got a video that I'm going to link above and below to show you an example using a simple exercise to identify motions that might be imbalanced and muscles that may be imbalanced that you need to work on. You can just click the link above or below to learn how the cat-cow exercise can help you identify a cause of back pain. That video is going to show you how you can test the muscles around your spine and the muscles around your abdomen to help you get rid of your back pain. But a big common mistake that people make is thinking that looking only at the abs or only at the back muscles is going to help you solve your back pain. And that's just not true. That's why people run into frustrations with physical therapy or with chiropractic. If you zoom too far in and get too obsessed with only the spine, you're going to miss out on a lot of the key pieces of the puzzle that help you solve your back pain. So let's look at one really common driver of back pain that nobody really talks about. It is your thigh. Back pain professionals often don't look anywhere below your pelvis, but the thigh muscles can be a huge problem if you've got lower back pain. There's a thigh muscle called rectus femoris that goes from the front of your pelvis down below the knee. It helps straighten your knee, but if it gets really short, it pulls your pelvis and gets it stuck in what's called anterior tilt. That puts your low back into an arch position, which is not going to feel good if you're stuck there all the time trying to run around and do all kinds of fun sporting activities or whatever you do in your daily life. Now, to test if that muscle is stiff and shortened for you, you can do a simple test, which is to try to lift your foot up, grab the ankle with your hand, and then pull the heel towards your butt. While you're doing this, you want to make sure that your abs stay engaged and that you don't tilt off to the side. So commonly what you'll see if you're really stiff is when you try to grab this, you have to like twist and torque and grab because that muscle is so short and stiff that it doesn't have the range to even let you bend the knee without pulling your pelvis into funny, awkward positions. So ideally, you want to be able to just lift it up and grab it without a lot of compensation. It's just bending the knee, grabbing, and then pulling it up. And from the side view, you should see that you should be able to then pull so that the thigh goes basically straight in line with your body and you can get your foot to your butt. A lot of people are going to be compensating like this with a big arch in the low back, or by turning and lifting the leg all the way up and out to the side. Those are not okay, and those are signs that that muscle needs work. If you found that you were not able to do that simple thigh stretch correctly and you compensated all over the place, then here is an exercise that can help you address that and gradually improve your range of motion and control so your back can feel better. Now let's look at how you can apply ATM in your daily life so that you can beat back pain yourself. One of the first things you need to do when you have back pain is identify the triggering events that lead to back pain. If, say, you find that you are picking up children's toys all the time and that's what throws out your back, then you want to think about the muscles involved in that activity and think about whether the muscles are prepared for that activity. If you spend all day sitting in a chair and the muscles of your hips and spine are just getting weaker and weaker 18 hours a day, 7 days a week, then when you go to do things that require those muscles to work, you might find that your back muscles aren't prepared and they start to hurt. So again, you want to ATM, always think muscles, in identifying why a specific activity might be causing you problems. Another very important thing to look at in your daily life is asymmetrical positions or habits. Whenever you're doing something in an asymmetrical way, you're training your body's muscles to be asymmetrical, and that will ultimately lead to discomfort. Maybe it's sitting on a wallet that's the size of a phone book, and that's twisting your pelvis and your spine. That is not a good thing. If you're under 25, this is what a book looks like. It's printed on paper and it has thickness, so if you sit on it, it actually throws you off. One final recommendation that'll help you with your back pain is to get good sleep. Now, I know you might be saying, well, my back hurts, so it's hard to sleep. That's fair. But to get better sleep will also help your back pain get better, so it will be a positive feedback loop here. So, first, let's make sure that you have good sleep habits, that you're not on your phone right before bed. Ideally, you want to have at least an hour before going to bed where you're not using the computer, not staring at the TV, not staring at your phone, so that you can actually let your brain rest and let the muscles of your body relax more rather than being all stressed out from watching whatever is going on YouTube or Instagram or Snapchat or whatever crazy thing you're on. A big piece of getting good sleep is also being on the right bed or on the right surface for you. Especially when you have back pain, you want to make sure you have a bed that actually helps you. We're going to have a video linked up above and down below that will help you understand how to choose a bed and how it can help or not help with back pain. When I was going through my worst long bouts of back pain, I had the x-rays, I was told to take Vicodin, and I luckily didn't get addicted to opiates. What I did get addicted to was trying to solve my own back pain problems myself by always thinking about muscles. So hopefully you find the strategies in this video helpful for you in solving your back pain problems. If you need more ideas, be sure to check out the description box for links to our back pain playlist. And If you feel overwhelmed by the process of solving your own back pain problems, I encourage you to check out the Back Pain Fix. It's a program that we designed to be simple and systematic so that you can solve your own back pain problems yourself. We'll link it up above and down below as well. If you found this video helpful, be sure to click the like button and leave a comment down below. Share it with somebody you know who's got back pain problems too, and don't forget to subscribe so you don't miss out on any future videos. As always, I hope you remember that pain sucks, life shouldn't.